Effectively, what we're trying to do with a stem cell transplant is to take the stem cells, which are the cells which grow up to form all of the blood. We take them from the donor and put them into the patient who has the blood cancer. But it's a bit more complicated than that. For the patient, firstly what we need to do is give them what's called conditioning. This means either high-dose chemotherapy or radiation therapy, which is aimed to completely get rid of their bone marrow. There's two reasons for that. One, we want to get rid of any last leukemia cells, and two, we need to create space for the new bone marrow or stem cells. In terms of putting the stem cells in, many people have this idea it's going to be like a kidney transplant where it's going to be cut out of one person and then put into them as an operation, and that's completely wrong. Stem cells are really clever in that when you put them into a patient's blood, they know that their home should be in the bone marrow, and they work their way through the veins and arteries into the bone marrow, and once they're in the bone marrow, they start growing, dividing and repopulating the bone marrow with a whole new bone marrow full of blood. The idea is to take stem cells from the donor, put them into the patient so that they'll have a whole new blood system which is hopefully free of leukemia, and which importantly would be able to detect any leukemia cells that might still be there and fight them off, something called a graft versus leukemia effect. Bone marrow transplant usually involves a long stay in hospital. Most patients will be in hospital for at least 3 or 4 weeks, and for some people it can be longer than that as well. It's often a time where there's lots of side effects, and most patients find it a very difficult time. Having said that, for many haematological malignancies, particularly in the relapse setting, bone marrow transplant is the best chance of going on to be cured.